Over the last few days, we saw an increasing number of Omicron cases. In fact, over the past week, we have detected a total of 1,281 Omicron cases. Yesterday alone, we reported 438 Omicron cases. Hence, it is very likely that we will see an Omicron wave quite soon, with local and international evidence indicating that Omicron is more infectious compared to Delta. We must be mentally prepared that the Omicron wave may be greater than the Delta wave we had experienced before. We are hopeful, however, that there will be proportionally fewer cases with severe illnesses. Preliminary evidence shows that Omicron is likely to be less severe than Delta. We are in a better position today to cope with Omicron compared to when the Delta first occurred. The vaccination rate for our population is now 87%, and we have made good progress on our booster program. To date, 42% have received their booster shot. I would like to encourage everyone to go for your booster when it is offered to you, because international data shows that boosters significantly increase the level of protection against infection and severe illnesses caused by Omicron. Besides having a highly vaccinated population, we have streamlined and simplified our healthcare protocols, as most individuals who are infected experience mild or no symptoms, and they can recover at home. This will allow us to preserve our healthcare resources for those who need them. Nevertheless, we will further enhance our healthcare protocols to further streamline management of COVID-19 cases. Minister Ong will elaborate further. It has been 2 years since COVID-19 reached our shores. I would like to thank everyone for your patience and assure you that even with the emergence of Omicron, we remain committed to living with COVID-19. In fact, with Omicron being highly transmissible and spreading faster, it is even more certain that it is not possible to eradicate the virus totally. Hence, we will have to find a way to coexist with COVID-19 while protecting our healthcare system. The virus remains unpredictable. There may be more variants emerging in time to come. We will need to remain vigilant and nimble and be prepared to adjust our strategy in dealing with COVID-19. I know many of us are frustrated with a protracted battle against COVID-19 and with the safe management measures, restrictions we have to abide by. But these measures are important, and they will help to slow down the infections, reduce the number when cases peak, protect our healthcare system and healthcare workers. I would like to take this opportunity to remind everyone to continue to exercise social responsibility, observe the SMMs, and test yourselves regularly. And let us continue to stay united in our journey towards COVID resilience. Thank you very much. I'll ask now the Minister Ong to say a few words.
Thank you. Happy New Year, everyone. I've just given an update on the Delta wave earlier this week through a social media post, so I wouldn't repeat those information. But in summary, the Delta wave has substantially subsided. This is despite the resumption of many social activities. And this means that our society has become a lot more resilient to the virus than before. And we are making strides towards living with COVID. And this is an important milestone. This is also the result of everyone's effort and our collective will. While cases rose exponentially in many parts of the world, we maintained our discipline, kept our mask on, stuck to our group sizes, got ourselves vaccinated and boosted, and kept our infection levels low. But an Omicron wave is imminent. Globally, Omicron is already fast displacing other variants as the dominant variant. And there have been record high infections in several countries. What is the situation in Singapore now? That brings me to a recent US CDC ruling. It has updated the travel advisory for Singapore to level unknown. And this is because the US CDC is not aware of our surveillance test numbers. So MOH is engaging the US Embassy as well as the US CDC to provide them with the necessary data. Just to be clear, we know our situation very well. Every week, we administer over 150,000 PCR tests, and that works out to over 21,000 PCR tests per day. Positive rates for these tests are under 2%. We also have 155 wastewater testing stations across the island. They are in housing estates, dormitories, nursing homes, etc. Only a very small handful are registering the presence of COVID-19 viral fragments. So we are sure that the incidence of COVID-19 in our community is currently low and stable. But Omicron is already in our community. While community cases are not high currently, Omicron accounts for close to 20% of local cases, and it is a matter of time before it starts to multiply quickly, and we must be prepared for that. So let me talk about our response thus far. When Omicron was first detected in November last year, scientists around the world all grappling to find out more about the variant. And so at that time, we adopted a cautious containment approach. We closed our borders to the affected countries in Africa. We stepped up the frequency of testing for travelers. We isolated infected individuals at NCID. We conducted very active and stringent contact tracing and quarantine around Omicron cases. Those measures helped to delay the introduction of the variant into our community and slowed the local spread. It bought us valuable time to learn about the nature and behavior of Omicron variant so that we can better respond to it. Today, we have reviewed overseas as well as local data with the time that we bought for ourselves, and we are able to clearly map out the characteristics of Omicron. Let me just go through them briefly. First, it is more transmissible than Delta. So we must brace ourselves for a much bigger infection wave from Omicron compared to the Delta variant. For example, at the peak in October and late October and early November last year, we were registering about 3,000 Delta cases a day. Omicron could exceed this by a few times. At its peak, Delta infections were doubling at 6 to 8 days. Omicron infections may double in 2 to 3 days. Second is the silver lining, is that studies coming out of various countries, South Africa, US, UK, Canada, indicate that Omicron infections are less severe than that of Delta. And the data has been very consistent, particularly amongst the vaccinated, and more so amongst those who are boosted. Locally, we have found this to be the case as well. We have so far accumulated 2,252 Omicron cases. Out of the 2,252 cases, 3 required oxygen supplementation, and all have been taken off oxygen within 3 days. So all 3 are now recovering. None has required ICU care as yet. So if these same 2,252 infections had been caused by Delta, based on our experience, we would expect about 30 individuals to require oxygen supplementation, ICU, or die. Third, vaccines, especially boosters, retain substantial protection against severe diseases and hospitalizations for Omicron cases. For example, UK estimated that the effectiveness of vaccines and boosters in preventing hospitalization is 72% and 88%, respectively, for full vaccination and boosters. DMS Kenneth Mark will explain these further. So unlike the last time I was speaking to you here, Omicron is now a better known enemy. We know how it attacks, among whom it is most likely to inflict the greatest harm, and so we can take steps to protect ourselves better, and then ride the Omicron wave as safely as we can. As a result, we are making a few policy adjustments. First is vaccination validity. But let me first give an overview of where we are now in terms of vaccination. International data has shown that protection against Omicron by a primary vaccination series is weaker compared to that against the Delta variant. It also wanes quicker, typically after 5 to 6 months. However, boosters will restore the vaccine protection against infection and severe illnesses from Omicron. Vaccination and boosters, therefore, continue to be our primary response. We are now delivering over 50,000 jabs a day, vaccination as well as boosters. But let me first talk about vaccination. By now, over 87% of our population has received 2 doses of their mRNA COVID-19 vaccines. Over the past months, we have managed to vaccinate well over 90% of every eligible age group. For example, for seniors aged 60 to 69, vaccination rate is 96%. For those aged 70 above, vaccination rate coverage is 95%. About 38,000 seniors remain unvaccinated, compared to 200,000 a few months ago. We have also recently started vaccination for children aged 5 to 11, and response has been encouraging. Our high vaccination rates have kept the number of severe cases low. As a result, even at the peak of the Delta wave, our hospital and our healthcare system was under stress, but not overwhelmed. This reflects the resilience of our population, young and old, men and women, Singaporeans, as well as PRs and foreigners. We would have been in a far worse shape if we weren't a high-trust society. Now, for boosters, more than 42% of our population have received their booster doses. Amongst those eligible, 78% have taken up boosters. Amongst just the seniors aged 60 and above, 89% have taken up boosters. So this is encouraging. Even as we accelerate the pace of vaccination and boostering, we must not lose our advantage over the virus. And we need to keep our wall of resilience strong. Hence, our experts have been keeping a close watch on the immunity levels of various vaccinated individuals. And that is why I explained in a previous press conference that we need to treat COVID-19 vaccination as a 3-dose regime for mRNA vaccines. On that basis, the full vaccination status accorded after 2 doses of mRNA vaccines and 3 doses of Sinovac, Sinopharm vaccines cannot last in perpetuity. The protection will wane after a few months, and it needs to be restored with a booster. I have therefore earlier indicated that there will need to be an expiry date for full vaccination status after 2 doses of mRNA vaccines or 3 doses of Sinovac, Sinopharm vaccines. We have studied the matter, and in line with the recommendation of our expert committee, the EC19V, MOH will set the expiry to be 9 months or 270 days after the last dose of vaccine of the primary series. So there are 2 durations to remember. 150 days or 5 months after you have taken your 2nd dose of mRNA or 3rd dose of Sinovac, Sinopharm vaccine, you will be invited to take your booster. 270 days or 9 months after you have taken your 2nd dose of mRNA or 3rd dose of Sinovac, Sinopharm vaccine, and then you have not taken your booster, your full vaccination status will lapse. This will, amongst other things, affect your access to vaccination differentiated venues such as malls, restaurants, libraries, etc. And this policy will be effective 14th February 2022. It's a Monday, but it's also Valentine's Day. Let me explain this policy with some dates, just to illustrate and make it clear. From now to 13th February 2022, as long as you have taken 2 doses of mRNA or 3 doses of Sinovac, Sinopharm vaccine, regardless of how long ago you have received those jabs, you will still be deemed as fully vaccinated. Then, on 14 February 2022, if your last vaccine dose was taken before 20th May 2021, that is 270 days or 9 months ago, your full vaccination status will lapse. So to maintain your full vaccination status, you will need to take a booster vaccine dose before the deadline of 14 February 2022. So we are setting the effective date quite a while from now, 1.5 months, 1.5 months from now, so that everyone whose vaccination status may lapse on the deadline of 14 Feb 2022 has a chance to get their booster jabs early and before the deadline. Those who have not reached the 9th month expiry or who are medically ineligible for boosters, you will not be affected. We have been inviting individuals for boosters 5 months after they completed their primary series vaccination regime. To facilitate bookings for booster appointments in the coming weeks, we will send out invitations a bit earlier for seniors aged 60 and above. So around 4 months, we will invite them. We have consulted the EC19V and they are supportive of this administrative move. I urge all eligible individuals to take your boosters promptly. Let us remain a high-trust, resilient nation. Now, the second important response is to prepare our healthcare system for a potentially high number of Omicron cases. DMS will explain the work that we are doing with regard to our healthcare capacity. In particular, if indeed Omicron infections are less severe and hospital stays are shorter, which is what international data is indicating, we can better leverage our CTF, our COVID treatment facilities, instead of straining our hospital resources. The majority of patients, though, would be able to recover safely at home without the need to be admitted to CTF or to hospitals. Here, we will adjust our healthcare protocols. I said at the last MTF press conference that we want to further empower our primary care doctors, especially our GPs, our general practitioners, to look after their patients who are infected with COVID-19. So let me explain how we are doing this. First, most people are familiar with Protocol 1 and 2. Just to recap, under Protocol 1, the individual who is not well will be asked to undergo a PCR test, and if tested positive, will be placed under home recovery program or conveyed to COVID isolation facilities, CTFs, or hospitals, depending on their disposition as well as their risk level. And then under Protocol 2, the patient is usually asymptomatic or experiencing mild symptoms. They will self-administer ART, and if positive, isolate at home for at least 72 hours. Thereafter, if they are tested negative with an ART, they can come out and resume normal activities. We will empower primary care doctors to trigger not just Protocol 1, which they are doing now, but also Protocol 2. We have since engaged our primary care partners, and I'm happy to share that they welcome this, and the new protocol will kick in progressively from tomorrow, 6 January 2022. So just to explain and illustrate, this means that under the new arrangement, individuals who see a primary care doctor will be clinically assessed based on their symptoms and health status. For low-risk individuals with mild symptoms, the primary care doctor will be able to make an immediate diagnosis and administer an ART on the patient. If ART is positive, a medical cert will be issued and the patient will be asked to isolate himself for next 72 hours. After that, if he tests negative on a self-administered ART, they may exit self-isolation and resume normal activities. But if at any point in time they feel unwell, their primary care doctor will be there to support them. If at any point in time they feel really unwell, they can always seek medical attention from our hospitals, including calling 995. To be COVID resilient, we must ride the Omicron wave as another rite of passage, just as we have done so for Delta. At the end of the next wave, we will be even more resilient than now, and we will have achieved another milestone. Then it is possible that we ride subsequent waves of COVID-19 just like we do for influenza every year, without major issues. Getting there will require our collective effort and cooperation, and each of us doing our part and taking care of each other. Let me now hand the floor to DMS. Thank you.
Thank you very much, Minister. I'll focus on the general COVID-19 situation based on the data we've had as of the 3rd of January and the 4th of January 2022, and the situation that presently exists in our healthcare facilities. Our local COVID-19 situation remains within control. Over the past week, we've seen daily local cases hovering around 200 on average, although the numbers have started to come up over the last 2 days. We've got 16 cases currently receiving ICU care, and the overall ICU utilization rate for both COVID-19 and non-COVID-19 patients is around 44%. These figures are significantly lower than when we experienced a peak in infection numbers in October, reflecting that the recent wave of Delta infections is indeed subsiding. However, as we have mentioned, we've seen a rise in the number of local cases over the last few days. This is likely to have been contributed by an increase in mask-off, close interactions between people over the Christmas and New Year periods. The ratio of community cases in the past week over the week before has risen sharply to reach 1.09 yesterday, after having been well below 1 since the 13th of November. While the number of reported local cases has increased, the majority of cases reported to the Ministry of Health remain of the non-Omicron and very likely Delta variant. However, we are seeing a growing number of Omicron cases, even as the wave of Delta infection subsides. The proportion of infected cases which have been tested positive for what we call the S-gene target failure on PCR testing has steadily risen. This daily percentage was 26.4% on the 3rd of January, and this contrasts with 16.9% on the 27th of December 2021 and 4.4% on the 21st of December last year. Both Mr. Ong and Mr. Gan have shared that we detected a total of 2,252 cases of Omicron infection, with 118 cases comprising imported cases and the remaining 438 being local cases. In the past week alone, we detected 1,281 confirmed Omicron cases, comprising 1,048 imported cases and 233 local cases. So over the last week, the incidence of Omicron cases has risen sharply. The Omicron cases comprise an average of about 18% of all COVID-19 cases reported to the Ministry of Health, and the proportion will rise further, driven by the high transmissibility of the Omicron variant compared to Delta and other variants, to an increase in the risk of reinfections amongst people who had previously recovered from COVID-19 infection due to an immune escape, and a lowered vaccine efficacy against the Omicron variant. And we therefore expect to see another wave of community infections soon. We will watch the situation closely to see if the increase in case numbers reported over the last 2 days reflects the start of such a wave in Singapore. Minister has shared our concern that the next wave may be bigger than the Delta wave we had dealt with in October and November. At its peak, we saw case numbers reaching about 5,000 in one day. But the number associated with an Omicron wave may far exceed this, perhaps even 10 or even 15,000 in a worst case scenario. This concern is consistent with the experience that has been seen in other countries, like in the UK, in Denmark, other European countries, and in South Africa. Minister has shared the emerging finding that there's also a lower correlation between the number of Omicron infections and the numbers of severe infections that require hospitalization, oxygen supplementation, or ICU care. And this has been reported in real-world studies from various countries, including South Africa, the UK, Canada, and the US. The studies report a 47% lower observed risk of A&E attendance or hospitalization compared to Delta, and specifically for any hospitalization, the observed risk is lowered by between 67 to 80%. With regard to severe infections, the observed risk among those hospitalized was about 70% lower. Notwithstanding the lower relative risk of severe infections with Omicron, the experience in England serves as a warning to us. The overall high numbers of infection means a significantly higher absolute number of hospitalizations or Omicron cases, despite the general lower severe infection risk. And these increased numbers of hospitalized cases can threaten to overwhelm the limited bed capacity in our hospitals, as is occurring in the NHS hospitals in the UK, even if the occupancy of ICUs in the hospitals remain manageable. The situation can be further compounded by a larger proportion of the healthcare workforce coming down with infections themselves when they're exposed to infection in their own homes and households, and they have to be placed on medical leave. And this is the case that has been reported in the UK. The lesson is not lost on us, and it reminds us not to be complacent with the general low local infection numbers that we presently see in Singapore. We presently operate more than 1,200 beds to cater for adult and pediatric COVID-19 cases in our public hospitals. The current bed occupancy is under 28% for adult patients. Our public hospital ICU occupancy is less than 44% for all critically ill patients, and of the ICU beds specifically dedicated to receive COVID-19 cases, the bed occupancy is about 7%. So we're presently well able to deal with the cases that have been detected over the last few weeks. The hospitals have cautiously started to clear some of their elective caseload for patients with less urgent conditions whose treatment and surgeries had been deferred over the last 3 months. We've also allowed the hospitals to redesignate some of the beds previously reserved for COVID-19 patients for use by non-COVID patients presently, so that they are better able to cater to the needs of these non-COVID patients at this time. We are, however, careful not to allow excessive drawing down of the isolation and ICU beds set aside for COVID-19 use, as the situation in the community may change very quickly given the high transmissibility of the Omicron variant. So the hospitals have also allowed healthcare staff to stand down from duties in the ICU and to start taking leave so that they can rest and recover from the high stresses of their clinical work. However, the hospitals retain the capability to stand up their healthcare staff at very short notice and to expand the isolation and ICU bed capabilities to meet any potential increase in hospitalized patients who need higher acuity care for their COVID-19 illness. Our community treatment facilities similarly stand ready to accept more COVID-19 patients. On the 4th of January, we had 3,850 active COVID-19 cases in the system, of which nearly 88% of them were in the home recovery program or in the community isolation facilities, as they were unable to safely isolate at home for their recovery. And just over 9% of COVID-19 patients currently need to be admitted either into our hospitals or in the community treatment facilities. The hospital and CTFs are reviewing their care and treatment protocols so as to better look after these COVID-19 cases, and this includes the administration of antiviral and monoclonal antibody therapies for high-risk cases so as to better improve outcomes and the chances of recovery for those who have a more severe infection. In anticipation of an increasing number of cases that may need more monitoring and care, the hospitals and CTFs will tweak their criteria to allow more patients to recover in the community treatment facilities to avoid overburdening the hospitals during a future Omicron surge. Minister has shared an important modification to our community protocols to further allow patients to recover at home and in community treatment facilities, while empowering primary care doctors to play a bigger role in caring for their patients with mild infection. Our family physicians at our PHPC clinics will be given greater discretion to make that clinical assessment, to guide whether their patients may safely recover at home under Protocol 2, and only to refer patients who are more ill or have more risk for complications to the hospitals under Protocol 1. The decision-making is based on clinical severity of the patient's condition and not based on the type of test that's used to diagnose COVID-19 infection. On vaccination, the overseas data shows that vaccination does make a difference in protecting individuals against infection, hospitalization, severe infection, and death. And this benefit is even stronger for those who have been fully vaccinated and who have received their booster dose. This is certainly so for the Delta variant, and while the vaccine effectiveness against Omicron is a bit lower compared to Delta, the vaccinations still provide a protective benefit against Omicron. As of the 3rd of January 2022, about 89% of our population has received at least one dose of COVID-19 vaccine, and over 87% of our population has been fully vaccinated. In terms of the eligible population, over 90% have completed their full vaccination regime. Among seniors aged 70 years and older, as Minister has shared, nearly 95% have completed their vaccination regime. Among those between 60 and 69 years of age, the percentage who have received full vaccination is even higher, at over 96%. Our booster vaccination campaign is making good progress, and ministers have shared also the figures of 42% having received their booster doses. But if we deep dive into the eligible population above the age of 30 years, whom booster vaccinations currently are offered, nearly 70% have received their booster vaccinations, and about 89% of the eligible population aged above 60 years has also received their booster. We urge as many people as possible who are eligible to come forward and receive their booster vaccinations as soon as possible. And this is important to mitigate the risk of waning antibody levels that can occur over time and to boost their vaccine-derived protection against severe infection, reducing the risk of being infected by Delta or Omicron variants. We are still seeing Delta infections, not just Omicron infections, and getting vaccinated and boosted protects you against both variants. There's no good reason to think that you may skip the booster vaccination simply because you think that Omicron infections are potentially less serious. The revised policy which Minister has announced concerning not recognizing individuals as being fully vaccinated beyond 9 months after their primary vaccination series has the full support of the Expert Committee on COVID-19 Vaccinations, or EC19V. They have made very strong recommendations that persons aged 18 years and above who have completed their primary vaccination should receive a booster dose of an mRNA vaccine not later than 9 months after their last dose in the primary vaccination series. And this also applies to individuals who had previously received recognized non-mRNA vaccines for their primary series, like the Sinovac, Coronavac, or Sinopharm vaccines. And further recommendations concerning the vaccination recommendations are included in our press release this evening. Vaccination for children between 5 and 11 years of age is progressing steadily. And as of the 3rd of January, 11.4% of children had received at least one vaccine dose in our vaccination centers. We remain confident that the pediatric formulation of the Pfizer-BioNTech vaccine is safe for children, and this has been supported by recent data released by the US. At the end of December last year, the US CDC reported on the safety of the Pfizer-BioNTech vaccines in children aged between 5 and 11 years. And in the period up to the 19th of December 2021, up to about 8.7 million doses of the vaccine had been administered to children in the US. The preliminary safety findings are similar to that of the clinical trials conducted before the FDA granted authorization in the US. There was a low serious adverse event rate and included local reactions like local injection site pain, some systemic reactions like fever, headaches, fatigue, vomiting, rashes, seizures, allergic reactions. 11 cases of myocarditis were reported out of 8.7 million doses administered, and this corresponds to a post-vaccination myocarditis rate of about 1.3 per 100,000 population, which is far lower than the rate that has been seen in the older population. So the dose reductions and the use of the pediatric formulations has preserved the efficacy of the vaccine and not compromised on the safety of vaccination. To put things into perspective, the rate of myocarditis and pericarditis associated with getting a COVID-19 infection has been reported to be as high as 45 per 100,000 in use between the age of 12 and 17 years. So clearly, the risk of myocarditis with vaccination is far lower than the risk of getting that same complication from infection. 2 deaths were reported in the series, but the CDC in the US have reported that both deaths are not caused by vaccination. We have been fortunate so far not to see many children infected with COVID-19, but the experience in other countries, including the UK and US, is not so sanguine. There has been a surge in the number of children being infected, and this is in part due to the fact that the children there were unvaccinated and continue to remain at risk of being exposed to and infected with COVID-19. With the coming Omicron wave, we expect to see more children being infected. And rather than deal with the pain of seeing your loved one, your loved child being infected, I urge all parents to accept the invitation to register your child for vaccination at any of our vaccination centers that cater for childhood COVID-19 vaccinations. Don't leave things to the last moment, thinking that you can wait until you see a surge of community cases come up before signing up. The Omicron variant is highly infectious, and you may find yourself overwhelmed by a large number of cases in the community over a short space of time. The vaccine-derived protection also takes time to mature, and it will not be in place until at least 2 weeks after you complete the 2-dose regime. So please do not wait and allow your children to be vaccinated as early as possible for their protection and their well-being. Thank you.
Good evening and Happy New Year. We said in December last year that it was a matter of time before we experienced the Omicron wave in Singapore. In fact, we were expecting this surge to happen as early as December, but as it turned out, our measures helped to buy us time and delay the spread of Omicron in our community. And so we were able to enjoy a period of relative calm over the month of December. But the indicators now suggest that this surge of Omicron infections in the community will be happening soon. We have done everything we can to prepare for this upcoming wave. We have taken the time over the relative period of calm in December to strengthen our healthcare system and to review and update our healthcare protocols, as you heard just now. Our situation in Singapore is different from that in America and many European countries. There, they had moved to liberalize, open up, and remove many, if not all, of their restrictions. And then when the Omicron surge happened in these countries, many of them reinstated restrictions, as you can see over the recent period. In Singapore, we have maintained the whole series of basic and sensible safe management measures, be it wearing of masks, keeping safe distance from one another, or having group sizes maintained at a certain level. We believe these safe management measures are important and appropriate. And so we will try our very best to ride through the upcoming wave of Omicron infections with our current SMM posture. In other words, we intend to keep to this posture as far as possible. We don't intend to relax further at this time, and we'll try not to have to tighten. Our key priority is to protect our healthcare system. So if our hospital beds and our ICUs are not overwhelmed, then indeed we will be able to ride through this upcoming wave based on our current SMM settings. And we are hopeful that this will indeed be the case, especially given the indications that Omicron cases are not as severe. But we also must be prepared for all contingencies. And in the event that the healthcare system comes under tremendous pressure, then as a last resort, we may have no choice but to tighten some of our measures. All of us also have a part to play in managing and dealing with this upcoming wave of infections. And here I want to thank everyone in Singapore for doing their part, cooperating with the measures and taking them in their stride. We all know it has been tiring because we have been tackling COVID for 2 years. There is considerable fatigue and frustration in keeping up with the rules. But despite all that, I think we are all cheered when we see how everyone in Singapore have, for the most part, responded to this crisis with that sense of solidarity, unity, and resilience. If we continue to stay disciplined and comply with all the SMMs, then we have a much higher chance of getting through this upcoming wave without having to tighten further. But if we were to let our guard down and take unnecessary risk, then transmission will be amplified, the infection wave will be much larger, we will end up with greater pressure on our healthcare system, and we may have no choice but to tighten. Take the example of what happened with the New Year's Eve celebration at Clarke Quay. Our investigations showed that this was not an organized event. What happened was that people started gathering together. They got caught up in the moment, and soon we had a crowd of more than 100 people at that location, with many flouting the rules. No SMMs, no safe distancing. And clearly it was a potential super spreader event. I can understand why people are keen to celebrate the new year, but such actions are not acceptable, especially when we are still in the midst of a pandemic. And so the enforcement agencies are continuing with their investigations. They are reviewing CCTV footages to identify the culprits. These people will be called in for interviews, and enforcement actions will be taken against those who have breached the rules. This happened during the New Year. That's over, but Chinese New Year is coming in a few weeks' time. And the Chinese New Year may be a time when Omicron cases are rising. So we cannot afford to have more super spreader events taking place during that time. And therefore, we would like to encourage and urge everyone to continue exercising personal and social responsibility and to comply and cooperate with all the safe management measures. Let's all do our part to keep our family members, our friends, and our loved ones safe, even as we usher in the new year. Thank you.
Thank you, Ministers and DMS. We will now begin with the Q&A segment. Dear members of the media, please remember to use the raise hand function on Zoom if you'd like to ask a question. A gentle reminder to speak slowly and into your mic when asking a question, and to keep to one question. Can we have the first question from ST? Timothy Goh from ST.
Thank you, Ministers and DMS. Now, I think many people had been speculating about the potential easing of group size restrictions in light of the coming Chinese New Year period, especially given the coming Omicron wave. So, Minister Wong said that we're going to adopt a wait-and-see posture. Just how long are we planning to stick to this posture? And when will members of the public know that the wave has passed and we can start thinking about easing of measures again? Thank you.
We are, as I said just now, we are keeping to the present posture. Group size remains at 5, certainly through this wave. When will the wave pass? No one knows, but I can't imagine the wave passing before Chinese New Year. So very clearly, through this period and through Chinese New Year, the current rules will be maintained.
Hi, thank you, Minister. Can we have the second question from Kang Wei from Zaobao?
Hi, good afternoon, Mr. DMS. So we see that for the increase in Omicron cases, most of them are actually imported cases. So actually, a lot of them are also. Is there any plans to do more arrival testing and also tightening of BTLs to prevent more Omicron from entering Singapore?
We have already made measures to enhance our testing protocol at our borders. And indeed, those were the measures that helped to buy us time. And that's why I mentioned earlier, we were in fact thinking that the Omicron surge might even happen in December, but as it turned out, I think the measures we put in place helped to buy us time. That was the whole intention of the measures, not to stop Omicron, because we have also said it's not possible to stop Omicron from coming into our community. At this juncture, we already have Omicron transmission in the community. So the focus is no longer about the borders anymore. This was last year. We put in place a testing regime. We bought us time to prepare for Omicron. And we used this very, very valuable time to strengthen our healthcare system and to update our healthcare protocols. At this juncture, now that Omicron is in our community, we have to learn to live with Omicron as we did with Delta. And so our focus now is to move towards living with Omicron, dealing with the wave as it comes, and we will have to make sure as we go through this wave that our healthcare system is able to take care of those who need care, as we highlighted just now.
Let me add a few more points. Remember, the restrictions are still in place. After Omicron came about, we did tighten the rules. So if you are returning even from a VTL flight, while you are not on SHN, you are subject to this 7-day testing regime. And that's how many of the imported cases are being uncovered. We also reduced the quota for VTL, so the numbers are also reduced. But question is, do you want to tighten further? Say stop VTL. You can stop, say, this particular country A now have high cases, so you stop the VTL entirely. It does affect our reputation, but more importantly, does it help? Because today is country A, tomorrow is country B, in Europe, in US, and then will be in the region, Malaysia, and so on. And before you know it, if you take that approach, you are back to closing down your borders. And what happened is we've gone back 2 years. And whatever we have achieved, we're giving it all up. So when we look at Omicron, if it's indeed a very transmissible virus with very harmful and bad outcomes, we will have no choice. We will have to hunker back down. We will lose another 2 years of hard work, and we wait for the next vaccine that can cure or that can protect ourselves against such a harmful virus. But when we will start to understand Omicron, it causes less severe illnesses than Delta. Remember, MOH and Saw Swee Hock School published an article not too long ago saying that with Delta variant, if you are vaccinated, the risk of you falling very sick, needing ICU care or die is less than that of influenza. That means that with vaccination, we can learn and we can live with Delta variant. And now comes along Omicron variant, which is less severe. And vaccinations still work. And with boosters, it will work even better. So all the more, I think the correct conclusion is that we can live with Omicron. Thank goodness, after what we found out about Omicron. So let's not take measures that actually undo all the progress we made, but instead, whatever we have achieved, try to build upon it. And that's why we are making these few changes today.
Let me just add that it's important for us to understand the significance of the connectivity that Singapore has with the rest of the world. Putting aside the economic importance of Singapore's as a hub status, But it is also important for us to ensure that there's opportunity for Singaporeans who are overseas to come back, as well as family members who are separated to be reunited. And that was the basis on which we have established the VTL for land between Singapore and Malaysia. So once we close all the VTLs, even without the VTLs, you will still have non-VTL connection between Singapore and other countries. Omicron would still be able to enter Singapore unless we impose a total lockdown and close our borders entirely. But we then have to ask the question, what do we do when we close the border? What are we waiting for? So when are we going to open it up? So that therefore, when we impose border restrictions, it is to buy us time to better understand the variant that is emerging, to better understand what we can do to counteract the new variants, the new threat that is appearing. And therefore, we did impose a stricter border control in the beginning when Omicron first emerged, but as we gain more knowledge about it, and we begin to adjust our border measures, and we also scale back our VTL in order to buy us time to prepare the healthcare system to be ready for the new wave, but at the same time to buy us time to get better knowledge about the new variant and how we can counteract it and whether or not the vaccine was effective against it. I think Minister Ong gave an explanation of what we were looking for during the last press conference, and we have now got answers to many of these questions, and therefore we are more confident now to be able to be in a better position to confront the Omicron wave that is oncoming. So I think we have to be very careful and to take a calibrated approach in managing all our countermeasures against COVID-19, including our border measures.
Thank you, Ministers. May we have the third question from Charlene from CNA?
Hi, Mrs. and DMS. So my question is, you've mentioned that the status quo will remain and tightening measures will be the last resort. Can I ask what specific indicators are we looking at to determine if we need to go for such last resort measures? Would it be hospital bed occupancy, or what's the significance of the weekly ratio as well, now that it's back above 1? Thank you.
The key indicators are indeed our healthcare system and the utilization of healthcare system, be it hospital beds or ICUs. The same indicators we used to monitor when we were struck by the Delta wave last year. The weekly infection ratio provides an indication of the potential stress that can come about a healthcare system, right? Because if the infection ratio goes up, it means that infection is rising, cases may be doubling every X number of days, and eventually a certain proportion of these cases will go into hospitals, a certain proportion will go into the ICU. With Omicron, we are hopeful, based on all the preliminary data that we have seen, that the proportion of cases that go into hospital and ICU will be smaller than with the Delta variant. And if that is the case, then we have a better chance of being able to ride through this wave based on our current settings.
Can I just add? You can't run away from three things: healthcare capacity, safe management measures, vaccination and boosters. So it's still your bicycle going down the slope. Your two brakes is vaccination and boosters, safe management. And if you crash, what is the healthcare capacity that can cure your injuries? So these three things, any country will need to juggle all three. There are countries that say, safe management measures, I'm going to open up, Freedom Day, and then let healthcare capacity bear the consequences. There are also other countries that take the other extreme, to say that healthcare capacity, protect at all costs, try to go for 0 deaths, 0 COVID, and then which means safe management measures has to be very strict. Total lockdown, city can lock down, borders can lock down. So for us, we try to take a middle path approach, which also means that it's not very practical to come up with indicators to say you breach this or that, and therefore safe management measures need to be tightened, because it's three factors, interlinked factors, balancing each other. So we do have to judge the situation. If healthcare capacity is healthy, ICU occupancy is not high, and booster rate, vaccination rate is even higher than now, then I say, yes, we have a very good chance not to tighten safe management measures. But if it's the reverse, then as a last resort, as Minister Wong say, you may have to tighten SMM. So you just have to judge and keep juggling these three factors.
Thank you, Ministers. For the second last question, can we have from Abigail from CNBC?
Hi, Ministers and DMS. Thanks for taking my question. The press release today said that people who receive non-mRNA vaccines will have to take an mRNA vaccine as a booster, but that Novavax may be available by the time these people are due for boosters. So does that mean that Novavax, a non-mRNA vaccine, will be accepted as a booster?
Thank you very much for the question. The Health Sciences Authority is completing its process of evaluation, and we will come up with a statement soon concerning the status of the Novavax vaccine. We are very optimistic that we will be able to get authorization to use the Novavax vaccine as part of our national vaccination program. And the EC19V are working through what the recommendations will be. In its use, we anticipate it will have an important role as a non-mRNA vaccine alternative for the purposes of boosting the population that we have. And this, in the evidence to date, shows a better vaccine effectiveness against Delta and Omicron compared to some other non-mRNA vaccines that we have available in Singapore. So it is a very high likelihood that we will make further recommendations concerning the use of Novavax as a booster vaccine as part of the national vaccination program as an alternative to mRNA vaccines. But we will make those statements once we confirm the status of the Novavax vaccine in regard to registration, as well as once the EC19V have completed their discussions and issued their recommendations.
Just a quick comment to complement what DMS have said. Based on the advanced APA, the Advanced Purchase Agreement that we have signed, and our previous statements, I think it has been very consistent that our desire is always to have a good portfolio of vaccines for our national vaccination program. Yeah. mRNA as well as non-mRNA. So inclusion of Novavax will be consistent with that posture we have held for all this while.
Thank you, DMS and Minister. For the last question, can we have polling from Channel 8 TV News?
Hi, Ministers and DMS, polling from Channel 8 News here. Can we get Chinese soundbite on two parts? One would be on the booster jab, the expiry date of the vaccination status, and another one would be on the current rules that will stay in place and likely to last throughout this wave and till CNY. Yeah. Then my question, I only have one question, which is, will lion dance activities be allowed during this Chinese New Year? Thank you.
Maybe you take the lion dance one first.
Whatever prevailing SMMs there are today will remain, right? So I'm not sure what we have for specific to lion dances, right? But if there is any doubt, we can put out clarifications so that the groups know exactly what to do, but we intend essentially to keep to the status quo.
好，谢谢你。我们的高疫苗接种率是避免严重病例的重要关键，所以在达尔塔疫情的高峰的时候，我们的医疗体制能够面对压力，不至于会崩溃。这也反映了我们社会的韧性这包括男女老少、国人和外籍人士。因为我们是一个拥有高信度的社会，所以我们现在面临的这个奥密克戎毒株，我们要加速让大家还没接种的尽快接种，可以打追加剂的 快点打追加剂，因为国际的研究显示，这个疫苗加上追加剂对预防得到奥密克戎，而且预防严重疾病还是非常有效的，这就能够保持我们的优势，保持我们的社会韧性。所以我之前在记者会上曾经说过，冠病 mRNA 的疫苗必须打完3支才算是完全接种。所以那些打完2剂的 mRNA 疫苗的人啊，以及打了3剂科兴或者中国国药疫苗的人，不能够一直算是完全被接种的，疫苗保护力会减退，所以我们必须打追加剂来恢复他的免疫力。所以我之前提到，这些人士打完接种的，完成接种状态会有一个有效期。我们研究了相关的细节，会把有效期制定在270天或者9个月，这也跟冠病疫苗专家团的建议是一致的。这个政策会在今年2月14日开始实行，也就是说，让我解释一下，现在到2月13日，只要你已经打了2剂 mRNA 疫苗，或者3剂科兴或者国药疫苗，你就算是完全接种。所以到现在到2月13日不需担心。2月14日开始呢，如果你在9个月前，就是270天之前，也就是2020年5月20日之前打了疫苗的，你就会失去完成接种的状态。要继续保持这个状态呢，你就得在2月14日2022年之前去打追加剂。我们的新政策，我们选在大约现在1个半月后才生效，这是让会被受影响的人士有时间快点去打疫苗。那些还没有9个月或者270天的期限呢，或者不符合医药资格的人士，你们不会受到影响。接下来还有一个问题，就是你重复一下，就是农历新年的问题是吗？可以重复一下吗？
是 OK， 所以就是农历新年，因为刚才黄循财部长有提到说，会跟着奥密克戎的这个病毒的演变来放宽防疫措施或收紧，然后预计到了农历新年都会维持现状，所以可以让你用中文也来说一下吗？
黄部长刚才解释到，就是我们新加坡跟很多西方国家的情况不一样，很多西方国家他们当疫情缓慢下来的时候，就大幅度的开放，甚至不需要戴口罩，甚至可以开party，很多事情都可以做了。所以当疫情又在起波的时候，而且遇到了奥密克戎的时候，我们见到很多国家呢就恢复了以前的这些安全措施。我们呢一向来一直都相当谨慎，虽然疫情达尔他疫波已经缓慢下来，但是我们有些开放，但是我们的态度还是谨慎的。我们还是需要戴口罩，聚集的人数是5位，公众场所呢还是要保持安全距离，所以我们没有大幅度的放松，也意味着，因为我们有预想到有另一个波又要来了，所以黄部长所解释的就是，我们会尽量保持现有的这些条例，来度过这个新的一波。这新的一波呢，现在还没开始。我们本来是想可能12月会开始，现在还没开始。等开始的时候，一波到高潮的时候，可能大概也是农历新年左右。所以我们预测到，在农历新年，从现在到农历新年这段时期，尽量的不可以放宽，也不收紧，保持现有状态，以现有的状态，尽量用现有的状态 度过新的一波。但是呢，逼不得已的时候，要是说我们的医疗体制承受非常大的压力，逼不得已，我们会小心的绑紧我们现在的措施。